Hello, everyone, and welcome to Wellness Wednesdays. I'm Dr. Kat, certified nurse practitioner and wellness coach. This evening, I'd like to answer some common questions about the coronavirus. As I'm traveling and in another city, decided to stay downtown, catch the bus from downtown up to the university so I could begin to learn the city. And despite my plans, I began to have doubts. I thought, well, maybe I ought to not take the bus. And I said, why am I having these thoughts? This has always been my plan. And then I realized that at the back of my mind was the coronavirus. And so, if someone like me, with my experience with these matters and in this field, if I can begin to have those kind of thoughts, I thought other people are having them also. And I know I've been being asked a lot of questions, and also have heard others answering a lot of questions. So I thought this evening, before settling in for the evening, after my work walk, I would answer some of the most common questions. And you can see it's I'm quite casual because this is a real channel. And I've taken my post-work walk this evening and put a scarf on my head because I don't want to be a fussy curly girl on campus tomorrow and decide, hey, I've been all around the city in this scarf. Why not just be real and share with you all the joys of a post-activity evening. So in doing that, getting back to the questions. So there have been quite a few common questions, and I'll answer somewhere between 6 to 7 of the most common. One of the first is, when should I contact my MD or physician or nurse practitioner or physician's assistant if I think I have the coronavirus? So if you have a fever, for example, of 100.4 and above, not 104, but 100.4, and other symptoms such as shortness of breath, feeling you just can't catch your breath, or difficulty breathing with activity like going upstairs and that's not your norm, especially if you, like me, have an underlying condition like heart disease or diabetes or chronic respiratory disease, then you want to call your provider and call, not go in, call them and ask them how to proceed. And if you can't get in touch with your primary care provider, call the local health department, hospital, or emergency room to get an answer to that question. Another common question is, why are they closing schools, for example, in universities or colleges, if children and young people don't seem to be affected by the disease? Well, they may not have symptoms or appear to be sick, but that doesn't mean they can't spread the virus. Remember that the incubation period, so the time from when you might contract or get the virus until when you get sick, if you get sick, is about 14 days. So though they don't seem to be getting as ill, it's not affecting them as much, they could spread the virus. And imagine if you're a young child and you contract the virus in a school setting and you go home to be cared for by grandparents and you give them the virus. So that's one of the reasons. It's a cautionary precaution or precautionary strategy. Also, I've heard this a lot, and I've talked about it, comparing the coronavirus to the flu. So they seem to be compared a lot, and people are asking, well, how are they different? Well, first, the incubation period for coronavirus is 14 days versus more like 3 days for the flu. And if you get sick, it may take longer to recover. So sickness averaging about 2 weeks, but could go up to 6 weeks. And really serious thing is that the mortality rate or the death rate, people dying from it, is different. So the flu, you have about a 0.1% death rate versus the coronavirus, and it's more like 2% of people who get it will die. That's still small when we think of all the different conditions, but it's still significant, and it's more than when you compare it to the flu. But they are still alike. They are both respiratory in nature and spread by droplets. That's why we're being encouraged to keep our a social distance, that 6 feet that everyone's talking about. And then this next question is really close to my heart because of caring for women most of my career. I've been asked, are pregnant women more at risk for getting the coronavirus? Well, we'd have to say that when a woman is pregnant, their immune system is weaker than when you're not pregnant or when we're not pregnant. So it is really important to work to decrease the risk for getting any sickness while pregnant, but in this case, the coronavirus. So those 5 tips we talked about earlier, thinking of them, washing hands, trying not to touch the face, the ears, nose, and mouth, coughing into an elbow, sleeping well, not staying on our electronics far into the night, and eating even better. Very important for a woman who's pregnant. And then the secondary part of that question is, can the woman pass on the virus to the baby? Well, we really don't know. And you hear that a lot. We think, but don't know, just because our experience with this particular virus is not as much as with other conditions. So, but it seems from the patterns that have been seen that the virus is not being passed through the placenta over into the baby. But still, to reinforce, it's very important for a pregnant woman to boost her immune system by doing things like sleeping well and eating better, and decrease her risk for infection by washing hands, not touching faces, and such. Another question I've gotten, and I heard someone ask on a question thing this morning from the television, maybe yesterday, but is there any way to tell if anyone will be sicker? Well, to date, it seems that if the person first presents or first has symptoms that are lower respiratory or has lower respiratory symptoms, what are those? Like being short of breath, having difficulty breathing, versus someone who has upper respiratory symptoms, which are like runny nose is upper respiratory, a sore throat is upper respiratory. Those with lower respiratory symptoms are more likely to have a more severe presentation or symptoms or illness with the virus. So, and I'm saying we think because we don't have significant experience with this virus. But I've started to read, when I read the CDC or I listen to other experts in the field, they talk about, well, studies show, and I thought, what studies? Well, we're talking about the 70,000 cases in China. Those are observational in nature, but we can start to determine patterns from seeing that many people get sick in this short period of time. Another question that I hear a lot is, and I have been asked, when will there be a vaccine? Well, I have to say that the time from now until a vaccine would be at least 18 months, and that's being really optimistic. Why? Well, first you have to learn a little bit about the genetic material of the virus, or the RNA. And once you know that, you have to develop a virus. And after you get a chemical solution together, you have to then do phase testing. First it was in animals, but phase 1 you have to do in humans and determine if it's safe. And if it's determined to be safe, then you have to do phase 2 trials or testing, where you look at, is it safe and efficacious, or safe and effective. So to have a vaccine ready in 18 months, if that happens, it'll be unprecedented. And also, I didn't mention that once you have the virus and you've done all the testing, you have to bring it to market. So you have to figure out who's manufacturing it, routes of distribution, those such things. So it takes quite a lot of time to develop a vaccine. And we hadn't had the need to develop one for this particular version of the coronavirus yet. So that's why it takes a little more time. So I have to say to you that one of the things I will be doing with this channel is being a curator of knowledge and information, meaning because of my experience as a board certified nurse practitioner or clinician, but also my experience as a researcher, both in quantitative and qualitative methods, I can take that experience and look at studies and look at evidence and information and curate it, determine which is of value and accurate, and share that with people. And most importantly to me, what I've always tried to do is make that understandable and accessible to everyday people like us. So thanks for taking time to view the video. If you like it, please give it a like, and don't hesitate